More than 19 million men and women are affected each year by sexually transmitted diseases. The Department of Public Health has a new campaign, Leave It to Us. Joining us is Deputy State Epidemiologist, Dr. Lynn Sosa, to explain what services are available. It's great to have you with us, Dr.
Thank
Sosa.
you.
First of all, for those who do not know exactly what STDs are,
Yes.
Can you explain what they are?
Sure. So there are a variety of sexually transmitted diseases, and they're diseases that are passed when people have sexual relations with each other. And the ones that we think about most commonly are chlamydia, gonorrhea, syphilis, and HIV.
Why are the numbers so much higher these days than in the past?
So there's probably a lot of things that are going into that. We have better tests, and so we're able to detect them sooner. And also cultural norms are changing. People have more partners. People are meeting partners in different ways. So there's a lot of things that are going into why we're seeing this increase.
So how do you prevent something from an STD?
Right. So the first thing is to make sure that you're protecting yourself. So condoms are a great way of protecting yourself from getting an STD. But there's lots of things that we can do. And one of the things that we do is when we get notified of somebody having an STD, in particular syphilis or HIV, we try to go out and talk to them and find out who their partners are, so that then we can go to those people and say, hey, we think you might have been exposed. Let's get you tested and treated too.
Let's talk about screening. What's the process for that?
Right. So basically, it's, we really recommend that people who are sexually active get a test at least once a year, especially if they're younger. So STDs, especially chlamydia and gonorrhea, affect especially people under 25. And so it's really important that they get tested at least once a year, and even potentially more often, depending how many partners they have.
What does that test entail?
Right. So it's usually pretty easy. So you can either get a swab or do a urine test. Some of the tests do require a blood test.
Treatment for STDs?
Yes, so all of these diseases, so chlamydia, gonorrhea, and syphilis, are curable with antibiotics.
Which is a good thing people need to know about, right?
Absolutely, yes, absolutely. And then HIV, while it's not curable, is treatable, and people live complete, full lives once they're on medication.
And you have a new campaign.
Absolutely.
And what is this one called?
Absolutely. It's called Leave It to Us. And the idea here is that, as I mentioned, one of the things we've been doing for a long time is going out and finding people so healthcare providers have to tell us when they diagnose somebody with an STD. And so we're able to take that information, go out and find people and say, hey, who have you been having sex with? We want to now go find those people and confidentially tell them, we think you might have been exposed. Let's get you tested and treated too.
We're looking right now at the public service announcement.
Right. So this is something we've been doing for a long time, but we wanted to put something else out there so that people really knew why we might be calling them, because it might be scary to get a call from us and say, hey, why is the health department calling me? But we're really there to try to help, try to make this an easier process, because it's also kind of scary and embarrassing to call your partner and say, hey, I have an STD and you need to get tested too.
How do you get people to open up, Dr. Sosa?
Right. So it is a lot of building trust and building rapport. So we have specially trained staff that know how to go out and approach people, talk to them, explain to them about STDs, educate them about how they're transmitted, build that trust with them so that then they can have that conversation about who they've been having sex with.
It really is important to communicate.
Absolutely. It absolutely is. It's a hard thing to do, even if you've been in a relationship with somebody for a long time, people don't always talk about sex or always talk about these types of things or who they might have had sex with before. So we're here to help make that a much easier process.
And it's so important because it affects your health.
Absolutely. So these STDs, while they're curable and treatable, if they're not, there can be complications, especially for women, can lead to infertility. And so it's really important that we get out there, and this is something that we know stops the transmission of these diseases.
Where can people get more information?
Right. So they can go to our website where these videos are. We also have posters about Leave It to Us, and we also have information about where people can be tested.
And that website?
portal.ct.gov/DPH.
Very good.
Yes.
Dr. Sosa, thanks so much for all that information.
Great.
So needed.
Thank you.